A multiple morbid patient taking 10 plus medications. How to safely conduct deprescribing in primary care? Gold standard, individualized prescription review. The most effective strategy is a personalized medication review by a general practitioner. This approach has been shown to statistically significantly reduce the number of medications without increasing the incidence of adverse events. Simply counting pills is the wrong approach. The focus should shift to assessing the clinical appropriateness of each medication, taking multimorbidity into account. Overcoming barriers, structured algorithms. The main obstacles for physicians are lack of time, the complexity of assessing drug interactions, and cognitive biases. The solution is to move away from intuitive discontinuation in favor of structured, multifactorial interventions and clinical guidelines that are integrated into routine practice. Key success factor: patient engagement. Patients' willingness to discontinue medications is usually high, but they often do not realize the risks of taking potentially inappropriate medications. Successful deprescribing is based not on a directive ban, but on patient education and a shared decision-making strategy. What can you change in your practice starting tomorrow? Don't put off discussing medication discontinuation out of fear of patient resistance. Start by identifying one potentially inappropriate medication and discuss the risks of taking it. The patient will most likely support your initiative.